Okay, we'll get started, guys. Thank you so much for coming to the live calving demonstration. My name is Dr. Cody Creelman. I'm a beef cattle veterinarian at Vet Agri Health Services in Airdrie, Alberta. I run a practice where we do exclusively beef cattle. We have nothing else. I don't do cats, I don't do dogs, I don't do sheep, I don't do pigs, just cows, and just more specifically beef cattle. So my clients range everywhere from 30 cows. Some of my clients have 30 cows. And some of my clients have 30,000 cows. So like a single family, a single farmer would have 30,000 cows. And I do everything that you could ever imagine to promote the health and welfare of beef cattle within Alberta. I have clients in Saskatchewan, in Manitoba, and British Columbia. I also have some veterinary practices across Alberta. So I own the veterinary practice in Fairview, Alberta, in Peace River, Alberta, and High Prairie, Alberta as well. And I go around every single day trying to help cows like Lucy out. So part of my job would be doing a variety of different things. I'd be consulting with cattle producers, and I would be setting up vaccine protocols. I'd be talking to them about different diseases that they were seeing within their herd. So infections in their eyes, skin infections, pneumonia is a really big problem in cattle. And I'll be consulting on what the appropriate and proper course of treatments are for any one specific disease. I also do individual animal medicine, so let's say a baby calf breaks its leg. I'm your guide. I come out to the farm, I take a look at the leg, I set it, I put a cast on, baby calf's good to go. I'm also an OBGYN, so part of my job is to help cows have their babies. So sometimes it's as easy as just directing a malpresentation, and sometimes that's as difficult as doing a cesarean section. So it would not be uncommon for me during the calving season for me to do several C-sections, maybe even in a day or in a week, pulling that baby calf out of the mom's abdomen because there's just no possible way to get her out the back end, just like it happens in humans. You guys are probably quite familiar with the cesarean section. In cows, we actually do it while the cow is standing. So I'll do a lidocaine block, so she can't feel any of the side of her body. Then I'll make an incision in her left flank. I'll pull the uterus out, I'll incise into the uterus, and I'll pull that whole big calf out. Now calves are typically between 60 pounds and 120 pounds, depending on the breed. So they're like a massive thing to be pulling out of the side of the cow. I usually have help from my technician, who would be like a veterinary nurse. I would have help from the farmers. Some vet clinics, they even have a winch system where you can hook onto the calf during the C-section and winch it out of the cow. After that, I would sew up the uterus, I would sew up the body wall, and she would be good to go. She could get into calf again, she would have a live baby, and everything would be good. So today, I'm going to talk to you about kind of like the cycle of cows and the pregnancy, and then when I get this phone call. In cattle, their gestation is 9 months, just like it is in humans. The breeding season in cattle usually ranges between 40 and 60 days. So out on pasture in the spring or summertime, that bull is going to be with the cows for about 40 to 60 days, and that's when they're going to get pregnant. When it's time for them to come in off of pasture, they come into the farmyard, and then it's my job to determine whether or not a cow is pregnant or if a cow is not pregnant. And the farmer typically only wants to keep the pregnant ones because the unpregnant ones aren't going to produce a calf the next year, and it's extremely expensive to keep that cow over winter. A typical cow would eat up to 7 round bales, you know those big round bales? Individual round bale can cost anywhere between $50 and $100, so you would have a $700 investment per cow if you weren't going to get a calf out of her the next year. So those cows would then be removed from the herd. They would go into the food chain, so in cows we're either breeding them or we're feeding them. There's no real options for cows past that. And what I use to determine pregnancy diagnosis is an ultrasound, just like an ultrasound that you guys would see in a human hospital. I see the exact same image. So this is the introducer arm. So this is actually a rectal introducer arm, so this would go into the cow's rectum, which is right there. It would go into the cow, and I would be able to see the calf. I would be able to see the uterus, I'd be able to see the placental attachments, and I can see the calf sitting there. I can see its heartbeat, I can see its brain, I can see its eyes, I can see its little hoof. So then I'm able to make a positive pregnancy diagnosis and tell the farmer, yes, this cow is pregnant, or no, it's not. Typically, I would be able to preg test around 100 cows per hour. So we'd be running it through a chute system like you guys saw in the back there. The cows would be individually ran through, they'd be dewormed, they'd be vaccinated, and then they would be preg tested as well at that time. So we can do about 100 an hour. After the gestation period, so calving season usually starts in Canada around January if they're a purebred producer, and that can range all the way into June, just depending on when the farmer wants to have his calving season. So he's kind of turning the bulls out at a specific time, and then that timing correlates with when his calving season is going to be. So like right now we're in July, so now this is this producer's calving season, and he noticed with Lucy something was wrong. Usually cows have 3 stages of parturition, of labor. So the first stage is a nesting behavior. That's stage 1, where those cows are starting to feel like maybe the calf is starting to come. She's going to go off from the herd a little bit. She's going to be a little bit restless. It's just like in humans, like when my wife was having her first baby, she cleaned the whole house. That was her nesting behavior. She felt that something was coming. Cows do the exact same thing. Stage 2 is the actual labor itself. So that's the forced abdominal contractions. Those are the labor pains. Typically in a cow, once she starts those forced abdominal contractions, that cow's going to be on the ground in 2 hours. And we have this rule of thumb of 20 minutes. So what the producer does is he notices this cow is starting to exhibit that nesting behavior, so he's going to watch her more closely. Farmers will even get up in the middle of the night when it's cold. They'll go out at 1 a.m., they'll go out at 3 a.m., they'll go out at 6 a.m. to make sure that the cow is progressing. So he'll see, okay, she's maybe starting to calve, her pelvic ligaments are starting to loosen, her udder is starting to fill up, and he's going to start watching her. And once he notices she's having these forced abdominal contractions, that's when it's time to watch her really closely with that rule of thumb of 20 minutes. We need to see a progression every 20 minutes. So first we're going to see the water bag, 20 minutes later we're going to want to see the front feet, 20 minutes later we're going to want to see the head, and 20 minutes later we're probably going to want to see that calf up. So poor Lucy, she's been calving for 2 hours already. And the farmer says, that's it, I'm going to call Cody, time to call in the veterinarian. Cattle producers are often very handy when it comes to obstetrical work. I would say that over 95% of all calvings that happen on a farm happen without any sort of consultation or intervention with a veterinarian. We get all the hard jobs. So the farmer put his arm into her vagina, took a look, and was able to determine there's something wrong here and I don't know how to fix it. There could be a variety of different malpresentations. That calf could be backwards, that calf could be breech, so bum first. That calf could have a head back, that calf could have a leg back. We could have twins, we could have 2-headed calves. There could be so many different things that we could see when I show up to a farm. So I show up, say hi to Lucy. Hello Lucy, how are you doing? All of my calls in my practice are done at the farmer's ranch. We don't bring them into a hospital, I drive out. So I go, I'll card up here. So I show up at farm, I say hello Lucy, I get a brief history on her, I ask the producer, how long has she been calving? 2 hours, okay, I'll take a look. Before I get started, we're going to do a physical exam, everything looks good, she looks nice and healthy, she's standing here in the chute. We're going to do an epidural on her. So every calving that I do an epidural with lidocaine. So an epidural in a cow is going to be right here at the tail head. I put a needle in there and I'll inject local anesthetic, and that provides freezing to the rest of her back end. So she can't feel when I'm pulling a calf out. She stays standing though. It's called a low epidural as opposed to a human that gets it in the lumbar vertebrae, where oftentimes they'll lose sensation of their legs. So this is a low epidural. So now she has her epidural in place. I'm going to put on my gloves, my short gloves, because I'm only going to go wrist deep. Got glove number 1. You want to balloon? Worst balloon ever. How's that? Now you can give everybody high fives. put on my long gloves. The epidural is now taking effect. I have my bucket of water. So I'm going to get the tail off to the side. I'm going to wash up her perineal area. You can see Lucy's very anatomically correct. All the right pieces. So I'm going to wash everything up. I want everything to be sterile. Then I'm going to get out my bottle of lube. Lube is very important. Is that enough? More? Is that good? Okay. And then it's time to figure out the problem. So I'm going in and I'm assessing what I'm dealing with. Am I dealing with 2 calves? Am I dealing with 1 calf? Do I have 2 front legs? Do I have a head back? Do I have quadruplets? What do I have? So I'm putting my arm in there and trying to feel what's going on. The proper presentation in a calf coming out of the mom is not head first like in a baby, but it's actually the diving. It's actually a diving position. So the calf wants to come out like this. Now we can deliver the calf backwards. If the calf is coming breech or bum first, we're going to push that baby forward, reposition those legs and pull those back legs out. But the preferential way that calf is going to come out is diving position. So what I'm doing is I'm trying to determine what did that farmer feel and what can I do to correct it. So the most important thing is I want 3 things when I'm going to pull a calf. I want 2 front legs and a head, or I want 2 back legs and a tail. Now, a calf has a tail just like this cow, right? And imagine if we're trying to pull that calf out and I didn't make sure the tail was coming first, and it was acting like a wedge, that wouldn't be good. So we always want those 3 things. Now remember, how much does that calf weigh? Maybe between 60 and 120. I've had calves that have weighed 180 pounds. Just monster calves. That's as much as I weigh. So what I'm doing is I'm assessing what's going on here. I actually don't know what's going on. I didn't even check before I started this. Okay. So I feel like maybe I have a front leg here. Okay. And the reason that I can tell it's a front leg is the front leg bends the joints. It has 2 joints, and the joints in the front leg bend in the same direction. So you have the wrist and the knee bend in one direction. And then in the back leg, it's actually the opposite. So the wrist on the back leg bends one direction, and then the other joint bends in the opposite direction, like that. So I'm making sure that I have 2 front legs. I think I need more loop. Do you want to come up with 10? I'm serious. I need it. Let's help. More. More. Oh, that's good. Right? No, your first rodeo. Okay. Now this calf is anatomically correct. This is exactly what we see. Now sometimes I show up to a calving call, and this is what I do. The farmer says, I have no idea what's going on. I can't get this calf out. And I'll put my hand in, and I'll know right away I could get this calf out in 10 seconds. Like I got the leg, I know it's head back. So I'll look there with a very pensive look on my face. Oh yeah, this is a tricky one. Now count to 30 seconds. I'll kind of strain a little, even though I could pull it out right now if I wanted to. I'll strain a little bit, move around, get sweated up a bit, and then oh, it's a good thing you called me. I would have never been able to get this. You would have never been able to get this. This was almost a C-section, but I just got it in the last second. So then I start. This is what I see first. Those legs. This is what you see. You see these little legs sticking up. Okay. Now that calf is so big, there would be no way that I could physically just pull him holding onto him. It's slippery. I'm trying to fall back in. There's no way that I could pull that calf out like that. So that's where these come in. These are my calving chains. So we use these to put on the calf's leg to allow us to have a little bit of leverage. You know, there's a specific way we want to put these chains on. We want to get the legs out. Sometimes I have to do this blindly like this. So we get one loop around the leg. Here, come once again. I'm going to get you a little bit dirty. Okay, put out your hand like this. You guys see? So this is the special way that I'm putting it onto the calf's leg. It's going to be cold and slimy. Is that okay? Okay, so I'm going to put it on up here, around the calf's forearm. Okay. And if I tried to just pull the calf out like this, I could really hurt the calf because that would tighten down. So what I want to do is I want to do what's called a calf hitch. So you're going to need some shades. So I distribute the weight over 2 pressure points. And then once I have this, then I'm able to pull that little calf out. We should have just put you in there. What did you give us a button there? There we go. So you can wipe your hand on it. Like that. That's the price you pay for getting a balloon. Okay, so we got 1 chain on there. So that's what I'm doing in here now, guys. I'm putting that chain on that leg. I'm doing a half hitch. Can you see that? Just like I said, I always want to make sure that this part of the chain is on the top of the leg because that's where the leverage is. That follows the arc of the leg. So if I'm pulling a little bit harder, I know I'm not going to injure that calf. If I have the chain on this side, it goes against the curve of that leg and that puts a lot of pressure on that calf's leg. So I want to be as gentle as possible. So that's number 1. How many legs, front legs does a calf have? 2 front legs, right? Just like a naked guy with watermelon walking past. Hey buddy, you want to help? Come here, I need an extra hand. Put down your watermelon. I need 1 more volunteer. One volunteer. Volunteer. I need 2. If they're going to be your size, I need 2 of you. Okay, we got you. So now I got my chains on. Then I have these special handles, okay? So I put my handles on, then I don't have to hold the chain. Okay, so I'm going to put a little bit of pressure on there. It's really slimy. Okay? And then I'm going in and making sure that my head is in position. Okay? Okay, now it's your turn. Come here. And this is what I do. Sometimes I'm like, oh, I'm tired now. And then I ask the farmer if he can grab onto the chains and do the hard part. Okay, so now we got to make sure that the shoulders are engaged. Get a little bit of a pull. Just keep going backwards. I've got the head. Whoa, you guys are strong. That's what I look like almost every cavity. You guys are doing it. I think the nose is stuck. Okay. So the farmer's pulling and I'm pretending like I'm checking things out. Oh yeah, that's good. That's good. Good job. There we go. Nice and easy. Nice and easy. Now let's stop for a second. Now at this point, sometimes that calf has really big hips and he gets what's called hip lock. So that means that his hips are wedged inside of the mom's pelvis and he gets stuck. So if that happens, then I have some special tricks that I do to help position that calf and I try to turn that pelvis at a 45-degree angle because that's the easiest way to get that calf up. Okay, he's not hip locked anymore. Now, when he's at this point, the calf is actually okay. He's still able to get blood supply through his umbilical cord, which means he's still getting oxygen. No big issue. But if that umbilical cord was to get pinched or to break, then it would be go time. And that's the case with backwards calves because it's a longer distance between where the calf's umbilicus is and the placental attachment. So with backwards calves, we have to work much faster. But at this point, the calf is still getting oxygen. We could go away and have coffee at this point. But we won't. Okay, keep pulling, guys. Nice and easy. This is exactly what it looks like on fire. Keep pulling. Whoa, there we go. Okay, the calf is good. So what we do is we do calf resuscitation. Can you guys see this? So this calf, I can see him blinking. And what I'm doing is I'm trying to stimulate his central nervous system. So I'm rubbing on his chest, rubbing in his ears. I clear his airway, so I get a piece of straw. I stick it in his nose and I clear the airway. I'm trying to get him to get annoyed with me and shake his head. So he starts putting his head up and he's shaking his head like this. And then mom has one more uterine contraction and I get splashed again. So he's up shaking his head. I can see his airways are nice and clear. So now we're going to put him in the calf recovery position. So we roll him over onto his chest, bring his legs up to his ears, okay? And this way, this allows him to get his chains off. Pull that chain off. Get his chains off. And now he's able to breathe. Let's give me a round of applause.